Welcome everybody to our first webinar for 2024 and our topic is Let's Talk About Personal Leave. For those that don't know me, my name is Carly Saw. I'm the owner and director of Strawberry Seed Consulting, and we're going to be deep diving into personal leave this evening. I'd like to start by acknowledging the traditional custodians of the various lands on which we attend from this evening, and also pay respects to the elders past, present and emerging. And I'd also like to extend that to any Aboriginal Torres Strait Islander people who are attending this evening. For those who are unfamiliar, this is my lovely team. We are Strawberry Seed Consulting. We are a boutique HR consulting firm. We basically work with clients all across the country on all things HR. We help with recruitment and training and advice and compliance. And these are the people that you speak to when you engage with our team. So I'm not going to delay. I'm going to get straight into it because there's a lot to cover this evening. But I think it's important to think about why we need to understand this. And the fact is that every employee in Australia has leave entitlements under the Fair Work Act, and personal leave specifically is set out under the National Employment Standards. Now, the thing about leave is it often seems to be confusing for people, which at the end of the day, leave itself is fairly clearly set out in the law. And fundamentally at its core, it's a legal entitlement to be absent from work. Now, then there is a number of different categories of leave that allow you that entitlement or employ you that entitlement to be absent from work. Annual leave is an entitlement that it has to be mutually agreed upon between the employee and the employer, but all other types of leave are specific to the criteria that's set out under the National Employment Standard. So what defines which type of leave is applicable in any situation is defined by the criteria in the law. And if an employee meets that criteria, they are entitled to claim that leave. Anyone who's attended one of our sessions before will have seen this particular slide. I think it's always important to remind ourselves of what are the laws that govern our employment. And the thing that underpins all of our employment in Australia is the Fair Work Act. And that sets out the minimum standards of employment and all the laws around employment for everybody in this country. The National Employment Standards are kind of like the 10 Commandments of the Fair Work Act. They set out the specifics on the minimum employment conditions that every employee gets, and that includes all types of leave. The next layer in our system is industrial instruments, so that whether that's an award, that could be a profession-based award or an industry-based award, or an enterprise bargaining agreement. And when it comes to personal leave, generally speaking, most awards refer back to the Fair Work Act and the National Employment Standards. They don't go into any more detail, but it is always worth checking the industrial instrument that is applicable for your business, because if there are any additional entitlements under your award, they have to be at or above what's offered in the minimum standards of the NES, but you should at least check if there's ever any question. And the third layer is the employment agreement or employment contract. And that, again, can't be less than the 2 levels before it. And quite often, most employment agreements do just refer back to either the award or the Fair Work Act in regards to leave entitlements. But there are times when people might offer additional leave. And if you do that sort of thing in your business, anytime there's a question around leave, you, again, need to make sure you're abiding by what you've written in your employment agreements. So personal leave, which is also it's a combination of sick leave and carers leave, lets employees take time off to help them deal with specific issues. Now, that could be that they are not fit for work because they themselves have an illness or injury, and that would come under sick leave because they are unable to work. Or the other things are to care for a member of their immediate family or household who is sick or injured themselves. So that is what's called carers leave. Or during a family emergency. So there's an emergent situation that needs you to leave work and go deal with that. That also comes under carers leave. An example of that we saw sometimes during The pandemic is an example of a family emergency, maybe that the childcare, you've just been told the childcare centre is not going to be open tomorrow. You're the primary caregiver to that person, to that your child. It's an emergent situation, you know, needing a day to care for your child. They're not sick, they're not injured, but you can't in that short period of time make alternative arrangements. That would count as an emergent situation. You couldn't continue to use carers leave ongoing. You'd have to find another alternative arrangement of childcare if it was going to be prolonged, but for a day or two you could access your carers leave. So that's the sort of thing that might constitute a family emergency. So the entitlement itself is for all permanent employees. Casuals don't receive personal leave. There is 10 days for full-time employees, and it's pro rata for any part-time employees. It begins accumulating from day one. So there's no qualifying period. The moment you start working, for every hour you work, there's a point something per hour that you accumulate based on the ordinary hours you're working, and that rolls over from year to year. So it doesn't get exhausted every year. It continues to accrue to the end of your employment, but it isn't paid out on termination like annual leave would be. And it also can't be cashed out. I found out today there are 2 awards that allow you to cash out. They're very obscure awards. So unless you're under one of those obscure awards, you cannot cash out any leave unless you're under one of those awards. So once an employee has exhausted all of their personal leave, they are entitled to take unpaid sick leave. We'll get into it in a moment, but you can ask for evidence, and in fact we would recommend that you ask for evidence, particularly once someone has exhausted their leave entitlement. Once a permanent employee has exhausted their paid personal leave, they are entitled to take up to 2 days of unpaid carers leave for each instance that arises that carers leave would be applicable. And casual employees are also entitled to take up to 2 days of unpaid carers leave in each instance. And really what you're talking about with that is protection of your job. So, you're not considered to be unauthorised to be absent from work at that stage. So the job is, if a casual employee is saying to you, here's the circumstances, here's some evidence that why I need to take 2 days or 2 shifts that I don't attend, you can't just stop giving them shifts on that basis. That would be protected by them. Now, one of the biggest things that comes up, particularly around carers leave, is who is defined as an immediate family member or household member, because carers leave is only applicable to those that are listed in the award. So this is the list. It's your spouse or a former spouse, or former de facto, child, parent, grandparent, grandchild, sibling, or any of those relationships of your current spouse or former spouse or de facto. It includes step relations, it includes adoptive relations. The other thing is it includes your household members. So if you live with Great Auntie Mary, then Great Auntie Mary is a member of your household, then it would apply for her. If you live with Cousin Bob, it would apply to Cousin Bob, because you live together in a household with them. And if you're a primary caregiver for them and you're the person who has to help them, then that's applicable. But it really a lot of the time comes back to being a primary caregiver to that person. But it can also be a housemate, and I think this confuses people sometimes, but COVID put up a few of these examples, and if you've got a housemate that you live with that has no family at all in Australia or in the state, and they're really sick and they need someone to take them in an emergency situation to the hospital, if they're a member of your household, you can use carers leave to do that because you live together. So the last point there, which some people might find amusing, is it does not include pets. We have had several questions in the last period of time about carers leave for pets. Now, I live in a house where we have 2 dogs and a lizard, and, pets are a very big part of our family. But we're talking about the definitions under law, and pets are not included in that, in the same way your second cousin is not included in that. Now, that's not to say that you wouldn't give someone whose pet is really sick and they have to rush them off to hospital, or you wouldn't give them time off, but it's not going to come out of their personal leave entitlement. And we really recommend that you don't give leave to someone under an entitlement unless it falls in that category, unless it meets that criteria. And there's several reasons for that. But probably the most important reason is that those allocations are there and they're quite specific under the law. Now, we have seen scenarios, and some of this did occur during COVID, where someone being nice as an employer said, "Oh, look, you've got a lot of personal leave there. Like maybe you don't have enough annual leave, or given these circumstances, we'll let you take that leave out of that entitlement." You know, in this circumstance, and the circumstance you've offered that would not normally come under personal leave. Now, what can happen, and what did happen to a few businesses during COVID, is that down the track, 6 months down the track, that person has had to take some of their personal leave. They've run out of paid personal leave. And then their employer said to them, "Well, you've run out of paid personal leave." And they said, "But hang on, you shouldn't have given me that previous leave as personal leave," gone to Fair Work, and Fair Work has actually ruled in their favour and said, "Yes, I know you approved a week's leave as personal leave that never should have been approved as personal leave," so they are allowed to get that entitlement back. So from a risk point of view, we generally, there's annual leave is there for a reason. It's not just to take holidays, it's to do things that you need to do in your personal time as well. So whilst you might have a policy that says you need at least 4 weeks notice to apply for leave, in the example of the pet, if their pet was really sick, you might say, "Look, I'm happy for you to take the day off but it'll come out of your annual leave. It's not going to come out of your carer's leave," even though the word carer is in there and they're caring for their pet. So I'm going to jump into some of the frequently asked questions, and we've got a few to get through today. It was wonderful to see so many questions come through with the registrations for today's webinar. I also reached out to my team and asked them what are the frequently asked questions that they deal with, and also some of the more obscure ones. And I do encourage you to put your questions in the Q&A section as we go. So at the end, I will go through them, and if there's anything we haven't answered today, I'll do my best to answer it. But hopefully going through these scenarios in the next 25 or so slides, we'll cover most of the things that you want to know. So let's start deep diving. First frequently asked question is going to be around notice. So how much notice do I need to be given as an employer for someone to take personal leave? Now, it's not always possible to give notice for personal leave. We often don't know. We're going to wake up in the morning and feel like rubbish. Last Thursday evening, I went to bed a bit tired, woke up Friday morning and I couldn't swallow. It was like my throat had razor blades in it. So we don't always know in advance. So it's as soon as reasonably practical, really, that they should let you know. And ideally, that is before the start of a shift. It's a reasonable expectation that someone lets you know before they are due to be at work and start work that they won't be able to attend. Now, there will be circumstances, and we'll get into some of those, where personal leave does apply in advance. You know, if you're scheduled to have foot surgery, you're not going to be fit for work that day. You're not going to be able to attend work that day. So you'll know in advance that you will be taking a period of personal leave at that time. So it may be booked in advance, but it's not often that happens. It also happens a bit with carers leave, because, for example, if you know you've got to take your elderly parent to an appointment and you know that in advance, you can let your employee know in advance that you're going to have to do that on that day. Ideally, employees should specify how long they think they'll be off or expect to be off work. They may not know at that time. They may not have gone to the doctors yet. If they're just ringing in that day and say, "I feel like rubbish," they may not be aware yet on how long they're going to be off, but they might be able to give you a bit of an indication. If they've already been to the doctors, they may be able to give you a medical certificate and you'll have a better idea. And we'll talk about policy a bit at the end, but I do think that it's important to include in your policy what process you want someone to follow. Do you want them to call you? Now, when I first started in HR 25 plus years ago, you know, as embarrassing as it is, and, you know, mobile phones were just becoming prevalent and part of everyday life. And texting was a nightmare because you still had to, you know, press one button 3 times to get to a letter. But a lot of businesses were like, no, it has to be a phone call. I don't think it needs to be like that anymore. To be honest, personally, in my business, I don't care if my employee rings me, texts me, sends me a Slack message, just as long as they let me know that they're not going to be available for work. I don't mind what format that's in, but you can specify in your business that you prefer it to be a phone call or you're open to whatever form it's in. I genuinely think it should come from the employee themselves, unless there's a specific circumstance that, means they can't call in or they can't send you a text. I mean, I think for most grown-ups, having your partner or your mum ring in for you is, unless you're unable to do so physically yourself, is not great. But you can sort of specify what your preferred process is. In fact, we encourage it in policy to say, you need to let people know before the start of your shift. Who do you need to contact? And that's really important if, which hopefully they won't, somebody decides that they're going to treat personal leave like RDOs. And there's a bit of an issue there. Or, you can't discipline someone for taking their personal leave, but if they're not letting you know and they're not following that process that's set out in the policy, that could be the issue that you're speaking to them about, that they haven't let you know, or they haven't been, letting you know that when they're returning and things like that, and communicating with you. So it's always good to have that sort of thing in a policy. Now we're going to deep dive evidence. And there's quite a few slides on this because there's quite a few questions about this. So when should evidence be given? You as an employer can ask for evidence for any absence, because what you're doing is asking for evidence that they're entitled to take that type of leave. So you can ask for evidence that shows that they can't work because of a personal illness or injury, or that they needed to provide care to an immediate or family or household member. Medical certificates and stat decks are examples of acceptable forms of evidence, and generally that's what you're going to get. And realistically, it doesn't specify anywhere in the law or anywhere in what is an acceptable form. There's no list anywhere. It said this is acceptable and this isn't. Basically, it says the evidence must convince a reasonable person that the employee was genuinely entitled to take that leave or to be absent from work. And that's what the evidence needs to be. So can you question it? You can, but you should do it with caution, and you should do it only on a case-by-case basis where there is strong evidence that what they are presenting to you is dishonest, or maybe it's fraudulent, but it's not something that you want to be doing without a lot of evidence. And there was a case back in 2008, which feels like a long time ago now, where an employer did successfully defend an unlawful dismissal when they dismissed an employee when they took sick leave, and they provided a certificate, but they did so after they'd applied to take sick leave because they wanted to attend a football match. And they said that, I want to take a day of my sick leave because I want to attend a football match. They were told no, and they went ahead and did so anyway and just provided a certificate. And so not only did they sort of have that evidence that they'd applied for that reason and been denied, and then that they went and got a certificate, but the fact was they also attended the football game. So it was the dishonesty aspect that they were dismissed on. But they had the evidence, they had strong evidence. So it can be really challenging, because often you might have a suspicion that maybe someone's, taking a sickie, to use the vernacular, but you'd want to be really, really careful that you had strong evidence. Now, quite often we have people that ask if they have to accept a medical certificate that just states medical condition, because that is pretty much the generic thing that you will see on a medical certificate. There is absolutely no requirement under the National Employment Standards that a diagnosis is provided on the medical certificate. For privacy reasons alone, you're very unlikely to have the actual reason written on a medical certificate. And the AMA, the Australian Medical Association's guidelines, suggest that a medical certificate needs to include the name and address of the practitioner, the name of the patient, the date of the examination and date of issue, and the dates that that employee or the member of their immediate family was unfit for work. That's all it has to have. So if it's coming from a registered medical practitioner, then you have to accept it. You can, and you definitely shouldn't be saying to that person, well, what's wrong with you? Because they don't have to tell you. They've provided you evidence that they are entitled to use that leave. They do not have to tell you. So are there times when you are lawfully allowed to ask for more information? And the answer is yes. You have an obligation as an employer to provide a safe place of work. And there are times where it's considered reasonable to ask for more information. Now, the first of those is where there's been an extended period where someone's away from work, or the leave is going to be required to be on an ongoing or a regular basis. You are able, with the consent of the employee, to ask for more information. Now, you don't need to know specifics about their condition or anything, but you can ask for further information about how long it's anticipated they would be off. When they return, will they be able to return to their full duties? Will there need to be some adjustments made? So, you can ask questions, and we're going to get into that a little bit more. If an employee is returning to work, or claims that they're ready and recovered after they've been off for an extended period of time, and that could be a physical injury, but it could also be a psychological injury. Sorry, I'm getting raising of hands here. Sorry, Francis, I couldn't see what you were raising your hand for in the chat. So yeah, you're going to have to bear with me for a second while I try and work that out. Apologies. Skipped ahead. So where was I? An employee's return to work or claims to have recovered after a period, extended period of incapacity. So when that employee is returning, you can ask for a fit for work certificate. So you can actually ask for them to provide from their medical practitioner to have evidence that they are safe to return to work. So for example, I had an employee that worked for a large organisation, and they had cancer, and they had been off work, and we had a medical certificate that said they were off for another 3 weeks, and he started turning up back to work. And I said to him, I'm sorry, we have a certificate that says you are not back at work until that date. I can't have you back at work until you provide me a fit for work certificate from your medical practitioner, because right now what we have says you're not fit for work. And look, it's funny, on one end, you might have some employees that try and take advantage of and of personal leave as an entitlement of extra days off. But you also have people at the other end that present for work when they are unfit for work. Sometimes that might be because they can't afford to be on unpaid leave and they've run out of leave, or they don't have enough leave. But it also could just be because they want to come back for work. And this gentleman, he was bored out of his mind at home. He hated being off work and he just wanted to come back. But you have an obligation to provide a safe working environment. So, particularly if you have a certificate from someone and they're supposed to be off, do not let them come back until they provide you with certificates saying they are safe to return, and they can get that from their doctor. But also, it might be an example of if you've got someone who's off on a long-term mental health, and they, and they've had an ongoing issue and they're saying they're ready to return to work, there may be a case for writing to their practitioner about, what the best way to support them to come back to work and whether they are actually ready to come back to a full workload. So that comes into that next point there of workplace adjustments or things that you might require. You do need to mutually actually have permission to, whoops, didn't mean to do that. I've disappeared. Sorry, I'm trying to hide something else. You need to mutually agree with the employee to be able to write to their physician. So you need to make sure that you have their permission to do so. You don't just do it out of thin air, but it is perfectly within your right to write to them. And part of that reasoning is because employees don't always give their practitioners all the information. They want to come back to work. They may not be telling them all the parts of their job, but also, you know, you're getting secondhand information. So sometimes it's better to go directly to the source. And if the employment is in a safety critical position, or there's statutory requirements, you know, air traffic controllers can't come into work if they've taken any medication. So if you've got an employee that has to if you're in an industry where there's specific things where you have to disclose what medication you're on and what you may be in a position where you're allowed to ask a medical practitioner for more information in those circumstances. Fair Work takes a very negative view of employers who, without any good reasons, seek to go what they call go behind a medical certificate. In other words, you are second guessing what a medical practitioner has says because you don't believe the employee or for whatever your reason is. Certainly they do not consider it reasonable for an employer to go to a medical appointment with an employee unless they specifically invite you along. You cannot invite yourself, or to contact an employee's doctor for further information on their medical condition without their permission. So, you know, if you want to write to them, you have to go to the employer and say, here's what I want to write to them about. I don't need any of the specifics. I want to tell them exactly what your job is. And essentially what you usually do is you write a letter and you say, here's what the employee's job is. This is what they do. Here are the physical requirements. Here are the psychological requirements. And you're asking the medical practitioner to give you more information to let you know, like, you know, what are the chances of them returning? When they're returning, will they need any adjustments when they return? So that's why you would do it, and that's how you would do it, but you would do it with their permission. Another question we get a lot is, can a pharmacist issue a medical certificate? And the answer is yes, in some limited circumstances. So basically their guidelines are it must be within their area of primary practice and expertise. So if it's around the dispensing of medicine, so they know that you're on a medicine that will impair you in some way for work, they can write a certificate. The provision of pharmacy services, so advice on minor conditions and effective and safe use of medicine. So let's be honest, if we've got a common head cold, we don't often go to the doctor, we go to the pharmacist and we go in and say, we've got this symptom and that symptom and that symptom, and they prescribe things to us on the spot, because it's not bad enough to go to a doctor, but it's also, you don't want someone with a cold coming in and giving it to everybody else in the office. I think COVID has taught us that presenteeism, presenting to work when you're unwell, is not a wise idea. So in that instance, common head colds and stuff, like a pharmacist, it's within their scope of expertise to have spoken to you, to have sort of looked at what your symptoms are and given you some medications going to make you sleepy and write you a medical certificate. And in circumstances where they can reasonably form a view as to the employee's fitness of work, based on the circumstances that are in front of them. So generally speaking, it's considered most of those sort of things would be really short term, and they wouldn't be things that would require more than a few days off work. And the guidelines of pharmacists actually say anything that's more serious is to refer them back to a doctor for a medical certificate. Another thing that comes up is the term backdated medical certificates. It's a confusing term because what an employer might think is a backdated medical certificate is actually quite consistent with AMA guidelines. So it would be fine if a doctor sees an employee. So say, for example, an employee wakes up sick on Monday, they don't get in to see their doctor till Tuesday. They go in and see the doctor sees them on Tuesday, writes a certificate on Tuesday, but said they were unfit from work from Monday until Thursday. And they refer to that as a retrospective medical certificate. And it would be very risky to reject a retrospective certificate because, again, it would be considered that you're overriding the expertise of a medical practitioner who's given it out. And it's not your area of expertise. You've got to go by what they say. But you can check the validity of a medical certificate. Whilst you can't inquire about the specifics of the medical condition or anything, what you can do is make an inquiry with a medical practitioner's office about whether or not it is a valid medical certificate. Now, we have seen instances where people have altered a previous medical certificate with the date on it or something to try and use it again. There are known cases of people downloading some template off the internet, and you might think, well, I'm not sure about this. You can ring the medical centre and say, I'm just checking whether or not this doctor issued this person a medical certificate, and if it's a valid medical certificate. There's definitely circumstances where that is okay. I had a case of, we had an employee whose boyfriend's mother worked at a medical centre, and so there's some questions around whether or not it was a valid medical certificate. We had one not in the not too distant past with one of our clients where there was a bit of a grey area on whether it was a valid medical certificate. And actually the reason it came up was because they finally provided a medical certificate after being asked and asked and asked. And then they wanted to write a letter to the doctor because this had been an ongoing issue. And when they looked up the doctor's name and that medical centre, it didn't show him as working there. And when they rang them, he hadn't worked there for quite some time. So that's evidence that it might be, it's not a valid medical certificate because the medical certificate showed it as that doctor's surgery. So, you know, that's where you would get your evidence, possibly, if you do think it might not be a valid medical certificate. We do get asked a bit about online consultations. You know, COVID has made telehealth quite popular now. And so and it comes down to the fact that as long as that medical practitioner is issuing certificates in the same way someone would under the AMA guidelines in any other face-to-face situation, they are appropriate. And again, you've got to be careful about questioning your medical certificate if you don't have any other substantiating evidence, because you're unlawfully intruding into an area of expertise you don't have. There's a term that gets used sometimes, like you can't be a bush doctor. Like it's not, whenever we talk about issues with our clients around sick leave and things, like it's not up to you to decide whether someone's medical condition is valid. You might have your suspicions, you might doubt it, but if you've got a medical practitioner telling you it is, you can't be a bush doctor. You can't make that diagnosis yourself. You've got to make decisions based on valid medical information from a medical practitioner. So appointments, attending appointments and elective surgery, this comes up sometimes. Medical appointments and pre-arranged elective surgeries are only covered as sick leave if the employee is not fit to attend work. So if you're going in to have day surgery because you're having your wrist operated on, you're not going to be fit to attend work that day because you've gone under general anaesthetic and had surgery. But the appointments that you had with the specialist in the lead up to that, if you would have otherwise been fit and healthy to attend work, that's not sick leave. That's annual leave if you need to do it during work hours, because you would have been fit to attend work if you weren't at that appointment. So, you know, as I said, annual leave is not just for holidays, it is for other things as well. So the actual surgery, when you wouldn't be fit to attend work on that day because of that surgery, no, but the appointments absolutely would not come under it. It's interesting with caring responsibilities, because if you're the person that has to take that person to that appointment, like if your kid's sick or your elderly parent is sick and you need to take them to that appointment, that is caring leave, that's carer's leave. So it's going to come out of it. But you can ask for evidence. And I don't know about anyone here who's got children or parents or other people that they help. I'm in that lovely age bracket where I have children and I have parents that are aging. And you know, my mum had vertigo and I took her to an appointment, and the first thing they asked me is, do I need a certificate? You know, medical practitioners get that if someone's caring for someone and helping them, that they may need a certificate from work as well. So it's pretty easy to get the evidence, but I think that, you know, we'll talk a bit about trust later on, but, you know, I think it's just being mindful and taking into consideration all of the circumstances as well. Now, we often get asked if pregnancy changes the game in any way. And look, being pregnant in and of itself is not technically considered an illness, but some people are ill during their pregnancy. So if you're having illness and, you know, you're having severe medical conditions that are a result of your pregnancy, you're sick and you can use your leave. Look, it's quite interesting. I did a bit of a deep dive today on prenatal medical appointments and whether or not they should be under personal leave or not. Because other appointments wouldn't be. there's a general consensus out there that there's a bit of a blurred line around discrimination and other things as well. So I think in most cases, you know, when there are set medical appointments as part of a pregnancy, a lot of people just let people use their personal leave for that, you know, to take an hour or two to go to an appointment. So, you know, I think even just from being a supportive employer, it's a good thing to do. But yeah, there was a bit of debate, like by the letter of the law, it's not considered an illness. And so therefore, you know, you could probably refuse. But generally speaking, you know, as I said, I went a really big deep dive and looked at a lot of different legal opinions on it. And the general consensus seemed to be it's quite reasonable to allow an employee. And I don't think you would get pushback if they tried to come back and reclaim that down the track. Also, if there's an employee that's pregnant that has quite a severe illness as a result of their pregnancy, there are provisions for unpaid special maternity leave available for pregnant employees under in the parental leave section if it's a pregnancy related illness that is ongoing. So that's something that can be explored there as well. I want to get into payment because we get asked, can the employee use annual leave for payment once the leave is unpaid? So if you're a permanent employee and you've exhausted your paid personal leave entitlements, they might prefer to be paid their annual leave rather than receiving no payment in their absence. Employees can also accept that that will be unpaid and they prefer to keep their annual leave for other things. It's unreasonable for you as an employer to refuse that employee to use their annual leave. So you can't say, no, you've got to take it as unpaid leave if they've got annual leave there and they say, well, I would like to use that annual leave. You can't reasonably knock them back. But you also can't force them to use it. So the best thing to do in this situation is if you have someone who is on personal leave, you know, based on the fact that they either started with you or they've already used a lot of the leave or it's an extended period of leave, that they're going to go use up all of their leave in this period of leave. Ask them. Don't make assumptions about what they want. You know, before the next payroll, you know, if they've put in a medical certificate for a week, you check and they've only got 2 days available to them. Just send them a message and say, listen, we've just realised that you've exhausted all of your leave with this, you know, week off. What would you like to do? Are you happy to take that as unpaid personal leave or do you want to be paid it as annual leave? Just have those conversations. It just makes life a lot easier. Now, I'm going to step into excessive leave. This was the most popular question that was asked in varying ways by people who have registered for today's webinar. So how do you manage an employee taking excessive personal leave? Well, first of all, the word excessive is not defined anywhere. It's not a legal term. It's a relative term depending on who you are and how you see things. For some people, 3 days leave is excessive. For some people, 3 weeks leave is excessive. And so it's kind of a moot point because there's no definition of that word. Ultimately, an employee provides you with evidence that they are of a medical certificate or a stat dec that they are entitled to use that leave, are entitled to use that leave. Whether that's something that's short-term or long-term, they are entitled to use that leave if they provide evidence. So I don't like saying managing someone who has got excessive leave because you're not managing them, but it is reasonable that their leave or the amount of leave that they're taking, whether it's in one lot or other lots, may be impacting the business. Of course, it's reasonable that might happen. So it is okay to have a conversation with them, but the way you approach that conversation is really going to decide the risk that you're taking. So you can't just go, you've been taking a lot of leave. Why are you taking a lot of leave? That's not going to be a good start. It should come from a place of concern and support because that employee has that right to take that leave and you do not have the right to know exactly why. And if they don't want to share that with you, they don't have to. So I would start with, have they disclosed an ongoing medical issue? So the first question might be to sit down and say, listen, look, we've realized you've been taking a bit of leave and I just want to check in. How are you going? Like, is there anything we need to be aware of? Is there anything we can do to support you? So you're coming from a point of concern for their well-being. You're not coming from a perspective of, you're taking all this leave and it's impacting the business. Is there anything you can do to support them? If you can come at it, they might be very open to saying to you, look, this is what's going on. And, you can actually put some things to them. It may not be in that first conversation. It may be, cool, let's both go away and have a think about, is there anything that could help you? And by helping you also help us, because, we want to support you as best we can. But obviously there's an impact when you're not here. And if there's some more certainty to it, it might help both of us. So it may be that you put a few things on the table and have a discussion, do you need some time off? Particularly if someone's starting and stopping, like they're taking 2 days and then they're back for a few days and then they're another few days off, and it seems that there's an ongoing issue. If they're open about it and say, look, I'm sort of struggling with something, and it's it might be a conversation where you say, do you need a couple of weeks off to recover properly and then you'll be able to come back? Or do we need to look at maybe reducing your hours or your days? Would that be helpful? And put those things on the table with them, because maybe there's a mutual way that you might be able to at least get certainty to know when and when they're not going to be there. It might help them get better quicker and they're back at work in their normal capacity. So think about how you could support them over that period, but really try and come at it from that period, that perspective of supporting them. And, it's fine to say, look, and, that would also be really helpful to us, because obviously there's an impact when you're not here unexpectedly and it puts a lot of pressure on other people. So we want to just try and find the best solution for everybody. Under the Fair Work Act, employers have something called general protections. And one of those general protections is the right to take time off work if you are sick and injured. And another one to be aware of here is to not be discriminated against under anti-discrimination laws, to not be discriminated against based on an illness or an injury or a medical condition. And these are important because they are protected rights. And by a protected right, you can't take some sort of action against the employee on that basis. So you can't reduce someone's hours, change their roster, terminate their employment because they're taking their leave that they're entitled to pay and entitled to take. So as an employer, you can't dismiss someone because they're absent from work from a temporary illness or injury. If they've provided a medical certificate or a stat dec, and they've followed any requirements that are in the award or the NES, and that absence is for 3 months or less, or a total of 3 months or less over a 12-month period. So they're protected for up to 3 months from having any sort of action taken against them. So it's really important because otherwise they could make a claim on you. Now, a lot of people are aware of unfair dismissal claims, but a general protections or adverse action claim can also be taken, and that can be taken by an existing employee. They don't even have to be terminated. They can say, you reduced my hours, or you changed my roster, or you didn't give me this promotion and your basis for that decision was that I took leave. So, it's interesting. Sometimes people come to us and they say, we're having a performance issue with this person. They're taking all their leave and they're doing this and this. And the first thing we're going to do is not mention the leave, because it's a protected right. You cannot use it as a basis of any decision, of any performance management, of anything. So I think that's really important to be aware of when you're having these conversations. Which runs us nicely into the long-term sick leave. So when can you actually terminate someone? So an employee who are absent from work because they're sick or injured is protected from being dismissed. And as we just mentioned, and, they're less than 3 months, and they're not, that's 3 months of unpaid leave. So if they've still got paid leave, if you've got an employee who's been with you 10 years and never taken a sick day, and suddenly they're taking all of this, if they've got 10 years worth of sick leave, they can take that 10 years worth of sick leave. As long as they're providing evidence, they can continue to take that. So it's actually 3 months consecutive, or 3 months over 12 months of unpaid sick leave or personal leave. Now, here's where the exemption is. Section 351 of the Fair Work Act provides an employer must not discriminate against someone by terminating their employment for physical or mental disability. And if they do, then an employee may be entitled to take an adverse action claim or general protections claim. But there is a legal exemption, and that is meeting the inherent requirements of the job. So once they've met that 3-month qualifying, you can start the process of looking at whether or not they are actually going to be able to come back and complete their job and the inherent requirements of their job. So if an employee is no longer able to perform in the inherent requirements of the role, an employer can be protected from that claim. So the concept of inherent requirements of the job is going to vary depending on what that job is and what the requirements are of that job. But it'll include things like their ability to perform the necessary tasks and functions of that position. So if you have injured yourself in a way that you can no longer lift heavy objects and your job is lifting heavy objects all day, that's a pretty inherent part of that job, and you physically can no longer do it, there would be a basis of which to terminate your employment. The productivity and quality requirements, the ability to effectively work as part of the team, or the ability to work safely. So there's a few elements there. And an employer won't be in breach of the Fair Work Act if they dismiss someone who has been absent on a long-term illness or injury and they can no longer fulfill the requirements of their job. Now, what we don't want to do is look at our watch and go, oh, it was 3 months yesterday, let's pull the trigger and terminate this person, because you need to show that you, as the employer, if you want to take someone's employment away, you need to show that you have done everything you can to explore every other option and that termination is the last resort. So that might mean that you've explored, so if they are able to come to work in some capacity, that you have explored some reasonable adjustments to the role, with, reducing hours or changing their role, other positions, working from home, like you've explored every option. It's going to depend on the job. So you might offer them something that accommodates the injury. Maybe there is another position, if you're a larger organisation, they can move into. And obviously the smaller the organisation, the harder that's going to be. So if there are no reasonable adjustments available, you've looked at all those options, then only then should you consider termination. And look, I've seen many instances where once you sit down and start, if someone's been off for that period of time, once you sit down and start exploring those things with them, a lot of people just resign because they know themselves are not coming back, particularly someone who has been off work with like quite a serious illness. And part of this process is actually speaking to that. This is a point where you would be writing to a medical practitioner, because, you should be staying in touch with them during a long-term illness, checking in with them. And I should also say, if someone's on personal leave, you can't be checking with them constantly. I would highly recommend, if someone's on long-term personal leave, that you say to them, look, how are you happy for us to stay in touch? Would you prefer that to be text or phone call? Are you happy for me to check in and see how you are every now and then? Are you happy for me to check in just like your medical certificates for 4 weeks? Are you happy for me to check in with you just before the end of that, just to see how things are going and if you're going to be back, or if we need to make any adjustments? So, but get their permission on how you're going to do that, because if someone's on leave, you can't be constantly contacting them if they're on personal leave. Always ask them for those medical certificates. Someone's on long-term, they should be getting, they might be have something wrong with them that means that they are getting a certificate for 4 weeks and then getting it for another 4 weeks. So make sure that they are providing them to you. Don't get complacent with that, just let it lapse and suddenly it's 2 weeks have gone by and you're like, oh, actually we don't have another certificate. You need to be on top of that, because you need to be communicating with them through that process, and part of that is them communicating with you that they're still absent, they will be absent for this period of time. Keep written records. And if you do have a conversation with someone over the phone, it's always good to follow it up with a text or an email and just say, I'm so glad we got to chat today. I'm really hoping that you're feeling better. Just so we're both clear, you're going to send me your next medical certificate and I'm going to check in with you the day before you come back. So, because otherwise we're in the he said, she said kind of scenarios. And always provide that procedural fairness before you make that decision. an unfair dismissal is unfair, unjust, and unreasonable. So if you've shown that you've looked at all the options, you've supported them, you've done the best that you can, but there is no alternative but to terminate, then you can terminate. But it should not, it should be a slow process. It should be step by step. It should be taken carefully and slowly, and not look like you've been waiting for that 3 months to be up and now we're going to pull the trigger. Before we open up to questions, I just want to touch on compassionate leave, because sometimes this causes some confusion with personal leave. I think this is because before the Fair Work Act came in 2010, compassionate leave actually came out of a sick leave allocation, whereas it's its own separate leave now. So all employees, including casuals, are entitled to compassionate leave. It's also sometimes called bereavement leave. Compassionate leave can be taken when a member of an employee's immediate family or household passes away, or contracts or develops a life-threatening illness or injury. When there's a baby in their immediate family or household that's stillborn, they have a miscarriage, or their current spouse or de facto partner has a miscarriage. Immediate family is exactly the same definition as for carers leave, so I'm not going to go through that again. Employees are entitled to 2 days compassionate leave for each time they meet the criteria. This is not a case of, well, you can do this once a year and there's an allocation in the system. You know, I started a job nearly 25 years ago, and I was less than 3 months into the job, and two of my uncles died within 2 weeks of each other. People can't control that. Like, they can't control those things in their life. Like, they are outside of their control. No one wants them to happen. So, you know, they are entitled to 2 days for each instance. And if it happens to be there's 3 in 3 months, then that's how it is. Hopefully no one ever needs it, because none of us want to be in those circumstances. So it can be a continuous single 2-day period. It can be 2 separate periods of a day each. And it can be separate periods as agreed by the employer. If you're already on another type of leave, so if someone's already on personal leave or they're already on annual leave and this happens, they can take 2 of those days as compassionate leave and have that other leave credited back. And casual employees receive unpaid compassionate or bereavement leave. And look, it's one of those things, like, I've seen employers give 3 or 4 days. It depends. If they're a long-term employee, they've been with you a while, they're a great employee, you might give them more than that, but that's what their entitlement is. So just before we jump to questions, policies. I mentioned earlier, to avoid confusion, it's recommended you have a clear policy on all types of leave. And that at a minimum, this should include the requirements for notification and when you're going to require evidence. Because you can say, look, at management discretion, we require evidence, or when requested. Or you can say, look, after a long weekend or a public holiday, or 2 days or more, or either side of a weekend, like, you can have requirements in there. One thing that certainly came up in my deep dive today was, if you require certificates for every single instance for every employee, that could be considered unreasonable, because it might not always be practical for someone to get a medical certificate in all instances. And to be honest, you know, there's not a lot of benefit to it. So if you were ever trying to push and say, well, you didn't get a certificate for that 1 day of absence, and, you know, you're not consistent with that policy, it could cause you a lot of issues. So we suggest you build in discretion and flexibility. So often we have, you know, we work with our clients to work out what they're comfortable with. And then we always have, look, there's always management discretion in there, because there could be times where there is somebody who is taking, you know, 1 day of personal leave a month as an RDO, or somebody, you know, there's a history of them being erratic and not providing certificates or whatever it might. There might be other issues. So you may want to say, look, you know what, we'd like you to provide a certificate from now on, because they always seem to be a Monday after a weekend. Or you have the discretion to go, look, I know you're sick, don't come in, just take a few days and let me know when you're going to be back. So, you know, having a bit of discretion there is always good. And so just to finish up, I want to talk about the law versus culture. And I had a chat with one of our team members about this morning when we caught up, and we were talking about some of the things we're going to discuss today. The law is the law. The criteria for the different types of leave is set there. And we do highly recommend that you don't allow people to take personal leave when personal leave is not the appropriate type of leave. There's many other types of leave there for appropriate things. And if you're ever in doubt, you can always give us a call. But I think sometimes being a little bit compassionate and understanding is what affects your culture. So if you treat employees like they're a cost, they are going to act like they're a cost and want to use every one of their entitlements. So, one of the things for me in my business, I don't think I've ever asked one of my employees for a medical certificate because I trust them. I trust them until they give me a reason not to. So, I give them 2 mental health days a year as a benefit where they don't have to take a sickie to try and if they are feeling burnt out and they just need a day, they are I have a benefit that they can just say, Carly, I need to take my mental health day. No questions asked, go and take it. I don't need to know your reasoning for it. It's never been abused. Everyone's always been great with it. Now, that might not work in every organisation, but you might have an employee who you can tell is burnt out and you can tell is struggling. Don't wait until they've actually got to the stage where they've actually got a full-blown medical condition. Maybe pull them aside and say, look, how are you going? And they go, oh, I'm a bit burnt out, I'm a bit struggling a bit. Do you want to just take 1 or 2, you never take any interview personally. Do you want to take 1 or 2 days and just have some mental health leave? It's coming out of that leave, and then they're obviously not really fit to be at work because you wouldn't be suggesting it otherwise. But from a cultural perspective, I think it's always important to think of the impact. And I come back to that example about the pet. If you've got an employee, they might not have kids, but they might have their dog is the love of their life, and they're really sick. They're not in the right headspace to be at work. They're probably not working productively. So I wouldn't let them take it as personally, but say, do you want to take one of your annual leave days and just go and have a day? Or maybe if they're a great employee, you say, I want you to take a day. Those are the things that build your culture and the trust so that people don't abuse their leave entitlements, because the second you start treating people like a cost, they start acting like a cost. And I get it. I'm a small business owner. 2022, I've never paid out more personal leave than that year because COVID went wild and everybody got it and everyone's kids got it. And, it's the cost of doing business. If you're going to run a business and have employees, it's frustrating and it can be heartbreaking when it's really affecting your bottom line. But ultimately, it's an entitlement that employees have. And, you can waste a lot of energy being frustrated by that and taking that out on your employees as opposed to supporting them so they do come back sooner. They are more likely to not take leave when they don't need to. So I think sometimes you've got to take the culture into consideration as much as the entitlements. So my key takeaways for today, I would really like, didn't mean to do that. Have a clear policy. I really, really think it's important that you have a policy that lays out all the things that we talked about. Sorry, I keep pressing that button. Choose the right leave for the right situation. Be reasonable, be empathetic. Take into consideration all the circumstances. Don't allow people to take leave they shouldn't, but, and get advice. I should throw in there, get advice if you're not sure. Because sometimes and I think sometimes we overcomplicate it. So come back to the idea at the start that leave is a legal entitlement to be absent. So if someone is absent, it's got to fall into one of the categories. And if it doesn't, then they shouldn't be absent. And that's where we can probably help you. So before I jump into the questions and work out how to get them back up on my screen, we've got our next 2 webinars coming up. So our webinar in March will be 101 HR for Building and Trade with Helen. That is going to be a deep dive into all the HR things that you need to know when you're in a building and trade business. And then I'll be presenting in April on flexible work requests and the different types of things that you need for flexible work. And then mental health first aid training and leadership training, we've set our calendar for 2024. There is some face-to-face sessions in Melbourne and Sydney for mental health first aid and plenty of online. These are for our public programs where you can send 1 or 2 people. We also have our public leadership training workshops have been scheduled for the whole year, Melbourne, Brisbane, Perth, Sydney and Adelaide. We've got early bird discounts if you book early, and all those dates and all the booking information, all of that is up on our website and is available for you to see. We have our website where you can see all of our old or previous webinars. All the recordings are there, plus all of our social media. And we often do post on social media articles and things about things like personal leave. So it might be really helpful place to be. And that is question time.